We don't have testing available nationwide in every community, the amounts we need. We're risking another wave of infections when we reopen.
Congress's response to COVID-19 has so far been focused on trying to blunt the health and economic effects of the pandemic. But some lawmakers are also looking at holes in the country's public health preparedness, and some are calling for legislation to enact changes sooner rather than later. Several lawmakers have offered bills in the last few weeks that would give the U.S. greater control of its medical supply chain.
We have a critical shortage of medical supplies, masks, ventilators, coronavirus tests, and more.
Many of the supplies and prescription drugs that doctors use are manufactured abroad, and lawmakers on both sides of the aisle say that the U.S. should be sure that it can manufacture its own medical equipment. The bills range from studying what items the U.S. should manufacture here and how it might go about doing that, to a proposal from Senate Democrats that would require President Trump to invoke the Defense Production Act.
If he uses, for example, the Defense Production Act,
to manufacture equipment to make more coronavirus tests and protective equipment here in the U.S.
We'll be invoking the Defense Production Act just in case we need it.
Taking steps to address the nation's stockpile could be crucial to making sure that states don't see the same shortfalls in testing equipment and protective equipment for doctors should a second wave of the coronavirus hit the U.S. later this year. Officials already say that they're keeping orders for supplies like ventilators, which aren't necessarily needed right now, but could be needed in a second wave, to make sure that the strategic stockpiles are refilled later in the year.
So we're gathering them in the stockpile, so when we need them, they will be there.
In addition to looking at how the U.S. gets its medical supplies, expect appropriators working on public health issues to seek more money for the upcoming fiscal year. House Appropriations Subcommittee that oversees the public health agencies in the U.S. is already planning a hearing before the House is scheduled to come back to D.C. to vote on legislation again. The panel's top Republican, Oklahoma Representative Tom Cole, says that he's hoping the subcommittee gets a greater allocation than was initially expected given the pandemic.
We know coronavirus is coming back. We certainly need to be prepared for it. We can't put this country through another ordeal like it's going through right now.
Public health crises are often what bring both sides of the aisle together. One challenge to preparedness is that oftentimes if you say you're going to go back and look at the mistakes after and how the country could have been better prepared, the bipartisan moment has passed and those ideas can sort of fall to the wayside or only be implemented in the way that they were first halfway seen. By preparing for the next wave of the pandemic now, lawmakers might be able to hit that bipartisan moment and get some of those changes done.